Tonight I'd like to talk about the pros and cons of Affordable Care Act, otherwise known as Obamacare. It's actually pretty good. It covers wellness, preventive care, so a lot of people don't get into trouble later. It's comprehensive. It has a lot of things to it, like mental health and other things. Pre-existing was big because a lot of insurance companies would have people on their plan and then dump them once they got into trouble. It eliminated annual and lifetime limits, which is very important because people got into trouble when their medical care got over a certain limit, and then they had to go bankrupt. Children under 26, very good because a lot of young people today are not independent, and they should be covered. Market exchange, that was very good because it showed you all the different plans. Tax credits for middle class people, and expanded Medicaid, for people above like about 138% of poverty level. The donut hole for Part D, Medicare was filled, so seniors on 65 and older didn't have a problem with the donut hole. And businesses with 50 employees had to get Obamacare, but they also got a tax credit. And the budgetary Office of Budgetary, whatever it's called, Management and Budget, thank you. Estimated that by 2022 it would lower the budget by $143 billion. Okay. The cons is that a lot of people lost their insurance because their insurance actually were inferior plans. So people on their private plans or even on company plans, that's where the whole thing came up with. If you want your doctor, you'll keep your doctor. But it really was true that it was meant well, and the reason people couldn't hold on to it is because their plans really were inferior. Now, it raised costs in the short term because as people came in for wellness checkups, really they found out that they had illnesses, and those things had to be taken care of. But really, that is only a short-term cost because it saves the money in the long term to avoid the big illnesses that go undiagnosed. Okay, so there used to be about 45 million people who were uninsured, and so it cut it down to 27 million. This is a little outdated. It's probably closer to 30 million. Let's say it saved about 15 million people to give them insurance. The reason people don't have insurance is because they have religious exemptions, Indian tribes, or homeless people. Okay. The penalty was a big thing because if people didn't want the plans, they still had to pay a penalty. That was eliminated by the Republican Congress, which is, I'll talk about it later, really pros and cons to that. It raised taxes for people above 200,000, income tax and Medicare tax. Okay, device manufacturers pay a certain 2% excise tax for medical devices. And, medical expenses was harder to get. It was raised to 10% threshold, but really the new administration brought it back to the old way, so that's not a factor. Pharmaceuticals Pharmaceuticals are paying, it's projected that from 2013 to 2023, they'll pay $84 billion, which will probably be passed along to consumers. And there's a 40% excise tax on Cadillac health plans. Those are plans. That's all right.
What are you driving at?
Okay, I'll get to it. Okay, I'm still within time. 40% excise tax on Cadillac health plans, which are plans with 10,000 premiums per individual and 20,000 per family. Okay, so now I'm being told to get to the overview. The overview is, like I said, 15 million people got insurance, which is very good, but there's still about 30 million people who don't have insurance. What needs to happen is competition should go across state lines, and mandate was good because really we all pay for people who don't have insurance. It comes down to that anyway. So the mandate was good. The only problem is if you have community-based plans, that is, younger people should really not have to pay the same amount as older people because younger people's medical care is less. It's the opposite, it's the reverse of like auto insurance. Auto insurance, young people pay more because they get into more accidents. And okay, so here's the clincher to me, is that everything would be fine, and now this whole move towards, with the progressive movement to do Medicare for all, is really overkill. 180 million people have employment-based plans. That should not be disturbed. And the idea is that we should still encourage excellence in medical care. If a guy is a genius and goes to Harvard, that person should be able to give better medical care than the rest of people who don't work as hard. And if people have the money to pay for it or the plan to pay for it, then they should get that best medical care. So no socialism, no communism, no Medicare for all.
Any questions? All right, Sam?
Go ahead.
Alan?
Why is Joe Biden, who helped design Obamacare, think we needed an overall of health care? He liked Obamacare. He was part of the insiders that designed it. But now he says we need to change it?
Biden, okay, I still have time. Biden, unfortunately, doesn't know what he's doing. He's going against everything he once stood for. Biden is, is given the benefit of the doubt that he's a middle of the roader. Meanwhile, he's trying to placate the progressive wing, and I don't know how that's going to play at all. Because if he's walking away from his past, then he has nothing. Anything else? Go, Barbara. Go ahead.
I heard that a lot of people with Obamacare had to take tremendous deductibles to keep costs down.
Right.
They had like 5,000 deductible or 20,000 deductible, something like that.
That's true. Okay, so what I read about that is that it is stabilizing. Premiums are coming down. Deductibles are coming down. The insurance companies have to price it better. But the truth is that if everybody participates, which they should, it should be like everybody pays for Medicare, everybody pays for Social Security, and yes, and anybody who can afford it, like any tax, if you're too poor, you don't pay for it, but everybody should be involved, and that way your deductibles won't be too high, the premiums won't be too high. Okay, thank you very much.
Thank you, Abe.